Hi everyone, and welcome back to our podcast. My name is Dr. Stefan Scholz, and I'm truly excited again today for a very special guest, innovator, educator, thought leader in digital and aesthetic dentistry, the mastermind behind Smilecloud, Dr. Florin Cofar. Welcome, Florin.
Thank you.
It's a pleasure of having you here today. And before we start into looking to the present and future, the Denkoff Clinic was founded in 1991 by your parents. And
Yes.
Was it your destiny to also become a dentist?
Truth be told, I don't know about you, but when I was 18 years old, I didn't really care too much about these things back then. Yeah. So it was just going with the flow, both parent dentists. So really nothing out of the ordinary here. But then my actual click was when I finished dental school, not when I started dental school for
Very
some
interesting.
reason. That's when I got my trigger, so to speak.
Were there courses running already at Denkoff at the
No.
time?
No.
So that is something that you brought into the place, was it?
Being a generational business, so I was the second generation dentist, I saw in many ways in my parents' models, but somehow I felt that, maybe naivety at the time that I want to do things a little bit different. Especially when you're young, you always have an itch to reinterpret things, I guess. And the courses was not initially meant to be any sort of a business, was just inside education, okay? That was the initial thought, and just make it in a way that we don't have gaps within the team. So I wanted everybody to keep up the pace, and somehow it was the most logical thing to do, to somehow bring people in rather than have everybody go out. Eventually it changed and it got to what it is today, but it wasn't the initial plan for sure.
That's very interesting. Sometimes there is a red line in life and you don't really know where it's coming from. When did you start thinking about designing smiles individually, not, let's say, in an aesthetic parameter being pretty much all the same, but really the biometric principle that you developed?
I guess here you have a natural progression as well. Probably the first half of my career was all about trying to get things right, to fit in within the norms and all of that.
Yeah.
And the irony is that once you get there, you realize that you want to get out of the box. You spend a lot of time to get in the box, and then you want to get out of it. But long story short, at a certain point, once if you respect all the rules, the practical problem is that you end up always doing generic work.
Yeah.
It gets repetitive. It gets impersonal, and it gets also boring at a certain point. So that's how eventually it was the shift towards ways to individualize it, ways to give it more personality, more identity.
Yeah, and certainly an amount of curiosity from your end would have been helpful at the time. Was it the red or the pink aesthetics, or was it the patient's face that you wanted to look at differently at the time, or was it just looking outside the box?
It was simply, it all came from a curiosity of analyzing and understanding natural smiles.
Yeah.
Okay, so that's where I started. I just spent time to look at what I found beautiful in nature and try to understand what makes it beautiful, and try to break it down into elements and try to replicate those elements in the design process. That was the reasoning. Most of the time when you start something new, you always begin by emulating certain things, and it just makes a lot of sense, especially in what we do, that we take the part of nature that we find beautiful as a reference.
So the health above all concept had been in place at the time, and you were focusing on what became imperfection later on, is that correct?
Let's just say that that is something that is part of our education fundamentals. It just gets more mature in time. I mean, we know from education how things should be, and of course we strive to do things that are biologically sound, that are, you know, functional and all these things. However, the one thing which I think improves in time is the horizon in which we analyze that. So when I was in the early days, I was very much looking at the final of the case as the finish line. Whereas now I am just, you know, trying to look as much further than that, trying to understand the elements of longevity, trying to, you know, to see things in a more pragmatic way and to just prepare for a longer run. It's not just that, you know, I see that probably the finish line is ideally a first step.
Yeah, and isn't it also liberating not always to having be perfect from that point of view for that single step, but to expand the horizon, as you've said?
There is no perfection. The way that I look at it is just perfection is something very subjective, first of all. What is perfect for me might not be for you, and vice versa. And maybe also a bit naive, because it's also something that is grounded just in the very moment. I mean, you can finish your best work today, and next week you look at it and you will be able to see flaws already, and
Different things,
that's an endless process. So I think it is a call too. That's fine if you want to see it like that, but I don't think it's ever something that we can, you know, grasp.
And in terms of longevity, at how many years do you look when you perform the treatment plan, when you execute, and when you dismiss the patient after the first finish line?
Well, that's hard to say. I mean, you want to look as much as you have the opportunity to. No, I mean, I don't think the limits here are not set by us. They are set by circumstances. But generally, you want to take it as far as you possibly can.
Yeah, Eric tells us, Van Doren, you have to keep in mind after 20 years, you need to look into it. You think that's a good timeline?
I think that people like Eric and others that have this level of experience probably got there knowing something. I think it makes sense. I think it makes sense that pretty much if you look at good dentistry, we're probably looking at least 2 cycles of treatment if we talk about rehabilitation, for example. And again, this is not my experience, because I'm still in the first cycle in terms of time. If you're going to rehabilitate a patient at 40, you can probably expect to do it again at 60.
One more time.
This is if everything is, you know, in a good state, and any mistakes or any short sight probably will increase those the number of cycles, actually.
Do you think that switching from the analog era that you would have also started in, switching to digital, is making a difference in terms of longevity, or just in terms of predictability with your treatment plan?
In terms of longevity, you cannot say that if something has been done digital, it must be more longevity. That would be an inaccurate statement. However, I would argue the fact that if any treatment that has superior planning has an edge in terms of, you know, the more detail, the more depth you put into the planning, the more you can say that this might be directly proportional to longevity. What the digital does, especially in the way that we do it, it just reduces the gap between what you plan to do and what you're actually end up doing in the case. That's what today's digital does.
When did you start incorporating digital into your personal thinking? There must have been an idea first, particularly when starting to develop Smilecloud, and also in practice in your clinic.
I guess we started around 2012, and I always had an appetite for technology early on. I always felt comfortable with technology, and I always was a curious mind, and I always was a fast adopter, and probably I was always, you know, like not shy to just try out things, and that just, I guess, accelerates adoption when you don't have this fear. But the early days was pretty much just bringing in what what was there. So just, you know, the early CAD CAM and that kind of stuff. And then eventually I started to look from different angles to it. I like to always approach a problem from different perspectives, I think. Especially as we tend many times to zoom in, to many times tunnel our way into the solution, but sometimes I think it's always best to ask yourself, hey, does anybody else have a similar problem? Is there anything out there that we could, you know, adopt, that we could use, that kind of thinking process?
It wasn't too much around at the time, 2012, if I'm zooming back in my timeline. How important was the lab interface that you would have had at Denkoff at the time, or did that start later?
So the lab, just to give you like a brief timeline,
Yeah.
Denkoff was actually one of the first private dental offices with a lab in Romania post the Communist Revolution, one of the first ones. I don't know if it was the first one or among the first ones, but it was very, very early. Because what happened was, in the communist time, everything was basically state-owned, state-run, and then over the night it got privatized. And the lab was there since the very, very early days. So I just, let's say, benefit that it was there.
Yeah, seeing the other side as well.
Yeah.
I mean, we had our lab within the dental practice at the time, but it was very basic, so to speak. And when we were able to visit you at one of your raw courses in 2019, it was in July, that really opened up another perspective. Of course, you doing with your team an entire treatment within 3 days really was wonderful to see and witness, and sitting next to you and assist chair side really got me thinking, okay, this is all happening in 72 hours, but what's the lab interface? And although it wasn't a core part of the course at the time, that really helped me to overcome that hurdle, because that was a part I wasn't aware of too much in the beginning. What are the lab requirements? How is the information being transferred on such a short period of time? What are the traps and fallacies? And that really got me and my business partner Sebastian thinking on the way back from Timisoara here back to Freiburg. And that was the first decision we made. We said, we do have to have a lab, a digital lab that really closes that gap.
The lab is probably the heartbeat of a clinic today, I would say, whether you realize it or not. It gives you the pace, it can give you the predictability, or it can take it away, depends on how it's being used. For us, it's really a core thing, because it's very easy to align the level of dentistry that happens in the clinic by using the lab for that. The problem that we had in the past, like in the early days, I could remember, you know, you had these various levels of dentistry within the same team, which I think at a certain point or another, everybody kind of like struggles within the journey when at that point. For us, I think the lab was one of the key elements that really changed that, because it just creates a framework. It gives the pace, the cadence, all the elements that is really making the clockwork.
So that has changed over the years. I wouldn't say it was top down naturally, but looking back now from our perspective, I've learned most in the last 2-3 years from our lab as well. And I'm getting the go for my prep before I need to continue with the temporaries, for example. Being able to transfer that information and visualize and communicate certainly has made a big difference to us in our workflow. Could you agree on that?
In analog, many technicians actually are, firemen.
Yeah.
They just deal with whatever is there and make us look good and, fix things, because everything is so reactive, because they come in at a stage in the process where, there's already things that you're no longer able to change. In digital, I think it's fundamentally different, because it really forces you to plan and to have a thinking process, first of all, and then it brings also the culture to understand that you need to deliver certain input in a certain way so that whatever you planned is actually achievable.
If other dentists, clinics, technicians still run analog and want to switch to digital, do you suggest to go in incremental steps, or for a major leap, do it all at once? Do you start buying certain components, try out to it step by step?
You need a learning curve, of course. I mean, it all depends how much risk you want to take and how much discomfort you can eat in, right? Because some people might want to do it fast, but there is a learning curve, no matter what. And probably that will come with a lot of stress for everybody involved, because you need to sacrifice a lot of comfort when there is a major shift like this. That can potentially disrupt the normal operations for periods of time. This learning curve will be very ineffective, because you're gonna end up doing a case in both ways, because in the beginning you trust the analog and then you do the digital, but you want to have a backup just in case. Or in another scenarios, you end up redoing the work because you're not happy with it. And regardless, there is a cost, whether it's time, whether it's effort, whether it's extra actual cost, or whether it's all three. It's a combination of this that will happen. It's reducing a bit now because there's much more information available, but not that much, because also much more information means also confusion many times for people that start now. But regardless, I think you should pick your battles, okay? The way that, for example, I did it, I divided dentistry into, let's say, first I wanted to make sure that I can manage scenarios where conditions were favorable. Let's say you go for, probably veneer cases are the easiest, okay? Because a crown implies that you have more substrates, more types of substrates to manage, like usually different colors and more space to manage, which again changes material indication of that. It's not just how you prep it. So you take, for example, veneer cases and do like small, like tissue procedures, okay, probably that's the first tier. And then of course you have to go to manage like a single implant. Single implant in terms of integrated to your flow. And then you have adjacent implants, let's say, or multiple implants or whatnot. And then eventually you add up, and then you have ortho, and then you have skeletal ortho, and then, it can go up and up, and then you have orthodontic and plastic surgery and whatever, sky's the limit. The more you want to be holistic, the more you can add. But I think it makes sense that you have an understanding of your possibilities, also your limits, so you don't start things that you end up, having huge losses on, time or cost or whatever, and that you have a strategy. And I mean, for me, it's very simple. If I start a case, I always start it when I know exactly what I'm going to do in the case. If there's something that I'm not sure about, or I mean, why would you proceed without having that certainty? I mean, this is what planning taught me.
Yeah, it's interesting to hear about your thought process at the time. We didn't have our digital lab, and when we started founding it, and we did a little bit of numbers, we realized that we can't run both systems simultaneously. So what we did was what you've just described. Select the cases, straightforward, advanced, complex. So we picked the smaller cases, and basically from Friday to Monday we pulled the analog switch and went to digital, which made it easier for us to really start focusing on digital only. But there is a dip, or there was a dip in 2019, learning curve, as you've said. From my perception today, the communication between the technical devices, between clinic and lab, has become easier. So if I had to pick my timeline, like in Back to the Future, I think now it is easier to make that switch than it was 5 or 8 years ago.
Yeah, and also just to complement, there's something called in many processes, including like, for example, software, there's this, when you want to do any new flow, you have this called happy path, which is how things should work when everything is perfect, okay? It's like the scenario that you planned for. And then you have edge cases, which is, all the other scenarios that many times they require much more energy for an exception, okay? Now, dentistry is a bunch of happy paths, like the main narratives, like how veneers or crown lengthening or this and that, and then it's filled with all these little edge cases, okay? For example, veneers where you have, dark substrates one of the teeth, or veneer cases that in a bruxer, or veneer cases where you have to manage also tissue levels, or whatever. The point is to be efficient. When you are changing fundamentally the backbone of your business or of the way you work, you choose the clearest happy path that you can find, and you do not go to edge cases until you master the happy path, because if you're going to infringe this simple rule, you're just going to inflict yourself pain and everybody else that's working with you.
So trying to simplify and maybe also fail fast?
That's another concept from software, but that applies to other things. The way, I'll give you an example where that can apply in dentistry. So fail fast, just for everybody that's listening, means that you do fast iterations in order to find a solution. So instead of doing like something very comprehensive, you go for a proof of concept. Now this applies, for example, imagine that you have a functional patient. And you do not know exactly where to start. Imagine it's not the easy patient. Things are more complex than they appear. So there, usually imagine that you go, let's say, with spleen therapy. And spleen therapy, it's a scientific trial and error many times, right? So there, for example, with spleen therapy, right now what we can do is we can go faster because we have all of this planning possibilities. We can go faster to a more precise point and manufacture spleen fast, so we could have a hypothesis, materialize it very fast, and understand if it works or not in a fraction of a time compared to the times where we would adapt Michigan splints and do it the classic way.
Talking about the fail fast from the software side, what role does Smilecloud play, or did it do at the time it started 2018?
So fail fast, once again, it's only when you want to discover things. But it doesn't really apply to the early days of Smilecloud, because the early days of Smilecloud were very clear in terms of vision. We knew exactly what we wanted to do.
Tell us about it.
Pretty much we realized that we need again a framework before we continue, and there were solutions at the time. So imagine, like, if we talk storage and all these things, even if it was like 2016, you had cloud solutions back then, but none of them were, I think, lightweight enough and simple enough and visual enough. I believe this is extremely important towards what we needed. So these early days of Smilecloud was taking things from other industries that had them at a mature level, and adapting them to the dentistry needs, to some, at the time, modern, let's say, technological setups, okay? Because I remember I accidentally found a slide from like 2013. I was going through all presentations, and this is back from Christian Coachman and the DSD days, when it was all about support technology for all the files that suddenly appear in our professional life. The fail fast you're talking about comes later, when you have to do things that haven't been done before, for example. So there again, when you have to do something that hasn't been done before, first of all, you don't know how long it's going to take. Second of all, if you don't know how long it's going to take, you don't know how much it's going to cost. And third of all, you don't know if people are going to like it or not. So then you run huge risks, because you are putting a lot of time, cost, and investment to develop something that is a hypothesis. So there, to reduce this risk, what you want to do is just, create like incremental drafts. Don't go for complexity, just go for like the smallest proof of concepts, the smallest kind of MVP that you can do. And there, the cost of failing is reduced.
How is your international network helping with that, testing incremental steps and improvements?
Right now, Smilecloud has quite a multi-layered QA, I would say. Whatever that we do, so we have a culture that in terms of software development, we want always developers to write their own tests, okay? This is just something that brings in a certain ownership over the work. So a first incremental layer is you know, the developer writing tests for a clear specification of what he needs to do, okay? After that, we have an internal layer within the company where a bunch of us people just, you know, like mainly our internal QA and some product managers that play around with the feature to get the look and feel, because sometimes, you know, you can have surprises there as well. And then the third layer is MetaLab with power users, with people that are very proficient in these technologies. And then we have the beta groups. In these beta groups we have all this, as you know, the international community that is, I would say that the groups are very diverse and balanced, because we want to recreate as much as we can a non-biased reality, because if you go too much on one end, you might be creating a bubble rather than an emulation of a pragmatic reality.
It's exciting times ahead with the 3DNA launch just around the corner. Is there a specific feature or approach or way of thinking that you would pick now, looking back the last 12 months, where you think, wow, this has been the ultimate game changer for you or within the layers you just described?
At the conceptual level, if I am to choose, first of all, 3DNA is one of the, I would say, the few technologies that is an upstream technology. What does that mean? Okay, normally a lot of the software that we use is downstream, meaning that, you know, I'll give you the basic example, CAD, okay? CAD, for the most part, it has all been built to accommodate, you know, to work once you have a prep scan and to generate restorations and do all that, because you start from an indication. I mean, you have to go in the software and first say, okay, what do you want to do here? I want to do a crown or a screw retain, this or that. You have an order system. And this is interesting, because if we think about the narratives of modern dentistry, we know that we should have design before we have indication, right? I mean, indication is pretty much derives from design. That's why I believe that we need the kind of technology that is more geared towards having design as an output. This is one of the things that has a potential to change. I was talking to Weil the other day, and I think by accident he mentioned, or somebody at the table mentioned, that most of the things pre-design. Maybe that's a better word for people to understand, because most of the things we do today, that's generally true. We pre-design. We always have all the case done before we touch the patient. And that's where 3DNA comes in, because actual design does not really happen too much anymore in this scenario, because all you're going to do is you will use this design to guide pretty much everything that you're doing, and eventually you're going to copy it in the CAD part. You're not going to recreate. Because if you would recreate, it just defeats the purpose. I mean, why should I spend energy in doing something that I don't have the certainty that I can reproduce? And the second thing is, of course, nowadays, especially using AI and all of that, we're able to put this on video, for example, and to be able to render scenarios before we cut things, okay? Because one of the big problems that we have is all the cases which are not additive, no? And that's what we handle with 3DNA, and that's the majority of cases, actually.
It is.
So it's just to have a tool set for that, to not have a limitation, because generally, you know, you can handle any kind of scenario. I think it's really important.
Yeah, it's very intuitive, it's very visual. We didn't go into depth of communication or treatment planning yet, but it's the availability without limit regarding time or location. You can really access the information. You can communicate with a patient. You can just from a single photo do the rendering and perform smile design, as you've just said. It's basically within a few clicks. Depending on your approach to perfection, you could even do it with a patient sitting right next to you within moments and create that first idea in the smile design.
We basically went back to one session consultation again after 15 years. So we did in 15 years, we basically did like 2 sessions. One just document a lot and then do a mock-up in the second one. We are now again doing everything in one session. It's not about speed, it's about efficiency. Efficiency for me, it's what makes it all worth it. And
for
speed
the patient
is a
as well.
consequence of efficiency.
Yes.
That's how it is.
Benefactory, And I mean, time is scarce, and for the patients it's very nice to not having to come multiple times, but to really get a very specific idea right on the first visit as well. So again, helps to communicate better.
And I just want to tell you something regarding this, because we're just talking that all about Smilecloud is all about being able to visualize things. This is fundamental because of 2 reasons. Because it's probably the most universal language we use. Then this is going to be true everywhere. But then I remember something, like 15 years ago when I was working early days with Eric and all of that. He would always go and always want to see things on model. Before he would do a graft and all of that, he was always asking the technicians to simulate, because he always wanted to see before he does.
Interesting.
So there is this ability called spatial thinking, which is the ability to visualize things in 3D. And you would be surprised, but probably a fifth of people, including a fifth of our people in our profession, do not have this ability. There is quite a significant amount of people that cannot imagine, to move that chair like this in space. They actually have to do it and then look at how it looks to really take the decision of where the chair is going to be positioned. If you realize that, you realize how important this is. And as a fun fact, at a certain point, I was wanting to mention this in a lecture, so I went to ChatGPT or someplace and I was like, okay, how do you diagnose if somebody doesn't have spatial thinking? And then, you prompt this and then you get all the symptoms. And when I read the symptoms, what I realize is that I was one of them. This is ironic because now probably I have, I would say, above average, if not good, spatial thinking capabilities. But I didn't start like that. All the symptoms, like, the ability, getting lost easy, the inability to look at a map, this kind of things. I had all of them. Imagine how important this is when you're performing procedures, okay? Because imagine it's the scary reality of doing something because there is a recipe of how the procedure should be, but without a clear understanding or a clear idea of how it will look. I think that results in completely different outcomes in this world. And one of the things that really has always been my goal for Smilecloud, to make sure that this gap is bridged as much as possible. Because you realize in any 5 minutes in every day that this level of spatial thinking varies. And it's a very subjective one. So if we have a conversation here about something, it's all verbal, and we all go and have to draw what we talked about, I guarantee that, things will have different outcomes. So what we aim to do, again, is create a common denominator on things, create a very visual and a very clear way of what is the definition of done, what is the definition of a success in a case. And of course, I don't need to mention it, how relevant this is for the patient as well, right?
amazing to hear how powerful visual communication and training, in this case with Smilecloud, can become to bridge any pre-existing gaps if there. And I mean, we have a challenging job to perform with parallax and vision in a reduced amount of space within the patient's mouth. So it does become even more important to have a certain level of synchronized communication through the Smilecloud platform. Speaking of Smilecloud and design, you added Blueprint as another layer, as opposed to the previously existing Smilecloud version. How big is the impact that generates from that, being able to move teeth in 3D, having it on the spot, interact with a patient's or fast picture, etc.?
It really adds a lot of value as a support for the planning process. Why? Because if we compare again, let's say to traditional CAD, what do we have? We have a scan. What is a scan? A scan is a surface, right? And it is the outer surface of the gums and the teeth, right? So if you think about a rehabilitation, this is the most volatile layer. And that is the one layer that you will change doing procedures. What we know in anatomy, that there's more layers there that we know that we are guessing because we don't use those. So the first thing that Blueprint brings in a multi-layered anatomical model, which brings, you know, the ability to visualize all the structures that are subsequent, which completely will improve your thought process, and what you need to do in terms of design becomes much more clear and much more relevant, I would say. This is one thing, and of course the other thing is that we also had like Smile Design, which was a process here which ended up in an illustration completely disconnected from CAD here, okay? And now pretty much the way that we designed it, you have Smile Design that cascades into Blueprint, so this can always be combined. What that means is that Smile Design is no longer something that is disconnected, you just toss away when you've done that. It really changes to transform within the process into a real-time in-face visualization. So you end up having all the layers, and it's all simplified. In what sense? In the sense that we also turn from files to anatomical structures, which is more intuitive for what we have been trained, no? And second, the ability to understand that all of these things that we do in 3D is how do they impact the face. Yeah, I would say that these are very important, especially when you're planning things.
Yeah, you're making much better decisions, and what we found whilst beta testing with you is that communication between dentist and technician becomes more streamlined, particularly in the more edge cases, the challenging ones, because in previous times we started with a design, we gave it to the lab, a problem occurred, then we needed some input from the clinician again. And with 3DNA now we have the possibility to really play around with it in a shorter period of time and being much closer to what's possible compared to previous years.
I would say that this is probably, let's say, the intended role is that it supports this relationship and this process between the dentist and the technician, and really enables a kind of framework which solves the following problem. What is the problem that we all try to solve? You know, that the fact that we always start with one design and we end up the case with a completely different one. And I argue that we have reached a point where, of course, we still have deviation that is normal in every process, but I would say that we were able to exponentially reduce these deviations just by having simply a better framework in how to do things.
Would you even go as far and call Smilecloud an exocad killer? I know it's not being designed for that.
No, No,
Tell us.
I wouldn't go as far. I would say they are synergetic. Okay, they are synergetic because of course there is an overlap, but the real strength I would say that Smilecloud has before, there's procedures and done, and before there is all the things executed, and ExoCAD or any other CAD for
Of
that
course.
reason is has the role. Again, it's upstream and downstream. That's the difference. For me, this will always be complementary, but naturally, depending on how you use them, you can create more or less overlap. And that really depends on the context of how people use these technologies.
In terms of further developments, is there anything in particular you're focusing on that you can let us know? The launch date is in about 4 weeks, but a bit more into the future. Is there a certain project or?
Well, yeah, there are many, but I will just mention the ones that I can talk about,
Of
because
course.
we don't want to be communicating things that we do not have the certainty they're going to end up exactly how we envision them. There are, of course, many nice perspectives and many nice projects, and so I will just talk about the ones that pretty much we already have them in a polishing stage. And one thing which is still an issue right now is for this collaboration between dentist and a technician is that, let's say, imagine you come and you like the all the things that Smilecloud brings you, but then you go to your technician and your technician will say, yeah, but I have my own workflow, and for good reason they don't want to switch, and there's this rigidity on both sides. And what we tried to do, and what I think will be one of the nice things coming this year, is a solution for that. We are coming up with a new kind of project. It's a render-only project. We call it right now Signature Design. And what does that do? You can get a picture of a patient and the subsequent scan. So you just put them, just like in Blueprint and Allah, everything is automatic. And then you can take any design that you have on that case, and you can align it, or if it's already aligned, doesn't matter. And what we are going to do once you do that, and again it's a fully automated process, we are going to create a photorealistic in-face visualization of that, and that cascades into the before and after video, which means that enables any technician or anybody, like imagine even an ortho setup, or even somebody that does an analog walks-up and is able to scan it, or whatever. There's many use cases. As long as you're able to produce an STL of whatever you want to do, you're able to automatically create in-face visualization. At the same time, we also create like a review scene, which also gives you all the heat map and all that kind of stuff, and also the two videos. And it's like a very high leverage input output, meaning that you do pop, 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 3 clicks and you get a lot, I would say. And this allows, I think, all the guys that are, for one reason or another, they like to keep their flow very specific, hence the name Signature. They want to own the flow. We want to enable that, and to create, like this common denominator, because at the end of the day, as a dentist, do I care how you do things in the lab? No, I just want that, you deliver, and all I want is that I have a way to see it in a meaningful way before, I get to actually get it in my hands. So we need to be able to convert that into something that we can show the patient, and we have the nice videos all for that. And yeah, a photorealistic view on the face, which again will be a nice surprise this year, because there again things are ramping up. I gave you something, yeah, there is more.
Thank you.
But these are the things that I can disclose, because they are, let's say, in reach.
We'll stay tuned and stay excited, of course. And thanks for sharing up front, Florin. I'm already excited and happy to see what your signature feature will do to us in everyday workflow. So that is the near future. What about in 10 years?
I have no idea. Basically, that's the most realistic answer you can give. Let's just be more realistic and talk about the next 5, maybe.
Yes, please.
I think probably friendlier technologies, hopefully, because in many ways in dental still there's a lot of room for improvement in that sense. I think that probably we'll see a shift in additive manufacturing, aka 3D printing. Materials will improve. We're going to see much more application lab side. Maybe some of the milling technologies will gradually shift to assisted robotics or I mean, we can see these things coming. AI, of course, will be everywhere to automate various things. Bottlenecks will be materials, for sure, because that's what really dictates many of the things that, if we talk about additive, for example, that's the bottleneck, is materials. For the people that are scared of AI taking jobs and robotics and all of that, there's always going to be room for empathy. This is just the cycle of how it's always been. We do not know the real landscape, and it's naive to think that we do. I do not know how to make a roadmap even in advising my growing children. Do you? Do you know what to
No master
push
plan.
them to? Not really. I mean, at the end of the day, I think what is important is to remain mentally plastic.
Yeah.
That's the best preparation you can have, meaning that do not anchor too much in any kind of reality, that don't get too fond of it. Be prepared to, dance if necessary. There is always a scary side, but there is also a very exciting side. I mean, it was never in history of this profession so much possibility, no? There was never a better time to be a dentist or a technician than now. In terms of what you can do. We're not talking about, economic and all of these challenges, because many of these things are impacted on us from other factors. But in terms of how interesting this profession can be, it's at its height, no?
Yeah, exciting times for sure. And I've been doing dentistry for 25 years now, and I have to admit that it was never more exciting than being in this transformational period. And staying curious is what you said, helps to remain flexible for the future. Lifelong learning is another concept that has been at the universities, and it took me some time to fully understand, but the features we've been talking about really enable us to go with the flow over time, embrace AI, of course, because it's there and not going to go away, and already making our lives so much easier. And having said all that, what's your personal motivation to keep doing what you're doing? Is it technological advancement? Is it the people you surround yourself with? What drives you?
There's many things that I like, but probably if I am to look at this whole cycle of the things that I'm engaged, it's probably the discovery phase and the creative phase that I enjoy the most. Now, of course, there's a bigger cycle here, because how it gets from a simple idea to something that you can do, whether it's education or technology, and then all the rest, as you know very well how it works. But probably that's the part I enjoy the most. To just this, I guess, is that curiosity that I'm still feeding, and that I still is fundamental for innovation and for this. I also like dentistry as in general. Okay, in terms of I still like to do the work. I still, it relaxes me when I work. That's a good sign, I think, of being in the right place, doing the right thing. I recharge when I work. Of course, you have your stressful moments, but as a general thing, you know, I enjoy. Then again, it's about the environment. I think that you need to be competitive to a certain point to really have the privilege to work with the people that you look up to. So I try to be good in what I do so I can work with people that are good in what they do. So this is they all kind of like blend in. Then with the education is, of course, I feel that we are very privileged to do what we do. I think it's a unique privilege that you are able to travel the world and, you know, be able to do this. And of course, that again, it's something that you have to constantly earn it to be there. This is not something that's being granted. This is something that you have to constantly, you know, work for it.
Do you feel pressure having to work for it? Or is that within you?
I have all the self-pressure I need. Generally, I am very disconnected from outside pressure. Let's just say that I don't need anybody to push me. I do it myself, sometimes more than I should.
Got it.
Yeah.
Who are your mentors?
There's probably more, but the three that come to my mind is my father, Eric, and Paolo Cano. This would be the three people that I think I learned most from, different things, but, you know, added a lot to who I am.
So that's on the professional and on the personal level as well, I suppose.
You know, for me it's always a mix. I have to, embrace all the sides.
Wow, that was absolutely stunning, fascinating. So if you want to learn more, watch out for the Smilecloud 3DNA release on 23rd of October, coming very soon. And stay tuned with our masterclass, Digital Dentistry Masterclass, for more stuff to come. See you around.